Hello everyone, I am Vanshika from White Falcon Publishing, and today I am going to review a book called 10 Commandments in Clinical Cardiology by Dr. Mathew, which I believe is a book that every cardiologist should have in their bookshelves, and even everyone who is associated with the clinical departments and the medical departments of our country or even beyond the country. Let me start with telling you about what the book is about and what is it that makes the book stands out. So the book is basically divided into three parts, which is also mentioned in the blurb. One is history taking, two is clinical examination, and three is selected clinical cases. So let me briefly explain the three parts. So history taking is how one must get the story right and what are the questions that one must ask to make a difference and to question those differences. Number two, clinical examination is sort of mastering the hands-on skills, inspiration and everything associated in the field, which is a sort of a mastery and art in itself. Number three is selected clinical cases, and to study these cases, the real life scenarios, the examinations, the finding, to connect more with the people, to resonate more with the people. Every chapter in the book drives home a point that examining the patient isn't just a routine, it's a diagnostic, it's a ritual, and deeply informative that helps both the patient and the one who is examining to stay updated. And the book 10 Commandments of Clinical Cardiology exceptionally covers it all well. There are multiple things in the book that are very valuable, but there are sort of 3-4 things that I personally find very valuable, and I have made a note of those points, and I would briefly like to introduce you to those. Number one is emphasis on the technique, on how the author has collected, examined all the detailed methods of the patient, how to position the patient, how to listen to the patient, and it comes under a technique of writing a book, of presenting in a book, which is commendable. Number two is clarity and linking findings to pathology. It just doesn't say that you have a sort of XYZ disease and you need to be diagnosed and you need to be treated, but you're also taught what this disease means, how it has occurred, why a cardiologist is needed, and why this clinical cardiology in a larger aspect is a process that is happening in your life. Number three is as I mentioned, that it studies cases very deeply, some briefly, some in detail. So there are multiple there are multiple examples, and they are so well picked that you can practice and you can think like a cardiologist, so to say. Moreover, it's very user friendly and written in layman terms. It's for everyone to read. It's for people to understand what the commandments of clinical cardiologies are, and it's very practical, very consistent language, very clear. There is less technical fluff and more sense that the book entirely makes. So altogether, this book is a must have for everyone who is in the medical department, who is wanting to study bodies, the humans better. It is definitely important for medical students who are beginning their cardiological rotations, then the residents and junior cardiologists in the department, in the fields, the teachers who are teaching, clinicians who are in labs or are setting their environment to practice or whatsoever, and normal people like me and like you, to understand the concept a little more better. If I were to conclude about the rating of this book in terms of a non-fiction, which is very detailed, very informative, I would rate it 5-star of 5-star, because wonderful use of language, wonderful use of tone, wonderful use of details, and wonderful detailing that which I have mentioned again and again, which makes the book commendable. If you're serious about becoming a clinician par excellence, mastering not just a disease but also how to find the bedside, this is the book that will serve you well, and wonderfully well. So pick this up. 10 Commandments of Clinical Cardiology. This book is available on Amazon, Flipkart and WFP store. Get your copies ASAP and consider this recommendation of White Falcon Publishing, and spread the words to your friends in the departments of medicines, in the department of cardiology. Thank you so much.